Have you ever tried to build something without instructions? Or cook a meal without knowing the ingredients? It can be chaotic, and honestly, the end result is often not what you hoped for. In occupational therapy, especially in mental health, starting to work with a client without a proper assessment is much the same. These assessments are not just forms to be filled out or boxes to be ticked. They are our roadmaps. They're the foundational conversations that guide every single thing we do. They help us understand not just what challenges a person is facing, who they are as an individual, what matters to them, what they hope to achieve in their life. Think of it as being a detective of daily life. Our clients come to us with a story, but sometimes parts are missing or hard to articulate. Mental health challenges can cloud a person's ability to see their strengths or decide what to change. An assessment tool is like a magnifying glass. It helps us look closely at a person's ability to problem solve their daily routines, their motivations, the environments they live in. It provides structure to our curiosity and helps gather objective, meaningful information, turning guesswork into a clear, compassionate plan. Without this structure, support can become generic and less effective. We might assume we know what's best, but assumptions can be wrong. A good assessment grounds us in the client's reality. It ensures therapy is truly client-centered, tailored to unique needs, goals, and circumstances. This process is deeply respectful. It tells the client, I see you, I hear you, and we will navigate this together based on what matters to you. It's the first most critical step in building trust. Ultimately, these tools create a partnership. They empower both therapist and client. For the therapist, data and insight to design effective interventions. For the client, a chance to reflect, have their voice heard, and take an active role in their recovery. They turn, I'm not coping, into concrete goals. Like, I want to cook a simple meal 3 times a week. This shift from problem focus to solution focus is OT's magic, and it all begins with a thoughtful, thorough assessment. As you begin your journey as an occupational therapy student, you will encounter a wide array of assessment tools. It can feel overwhelming at first, like learning a new language, but let's simplify it. Think of these tools as different instruments in a musician's case. You wouldn't use a drum to play a soft melody, nor would you use a violin to create a bass line. The Canadian Occupational Performance Measure, or COPM, is one of the most powerful tools in our profession because its entire focus is on the client's point of view. It is not an assessment of what we, the therapists, think the problem is. Instead, it is a structured interview that measures a client's own perception of their performance and satisfaction. It detects changes in self-perception of occupational performance over time. We use it to identify the specific problems the client wants to work on, making it the ultimate client-centered tool, often used at the start to set goals and again later to measure progress. Using the COPM is a collaborative process, a guided conversation. First, sit with your client and ask them to think about a typical day. Ask them to identify activities they need to do. Ask them to identify activities they want to do. Ask them to identify activities they are expected to do. Group activities into 3 areas: self-care, productivity, leisure. The goal? Brainstorm important occupations without judgment. Understand what fills their days and what matters to them. Next, ask the client to rate the importance of each activity on a 1 to 10 scale, where 10 is extremely important. This helps prioritize. A client might list 20 things, but the ratings show what's most meaningful right now. After importance ratings, the client chooses up to 5 problems to address. For those 5, they rate current performance, and they rate satisfaction with that performance, again, on a 1 to 10 scale. Example: Sarah has severe anxiety. In the COPM, she identifies grocery shopping as a productivity task she struggles with. Importance, 9 out of 10. The Allen Cognitive Level Screen, or ACLS, is a very different kind of tool. It does not ask for opinions or feelings. It is a standardized screening assessment. It gives us a quick estimate of a person's cognitive functioning and their ability to learn. It's based on the idea that as cognitive ability changes, so does ability to perform routine tasks. What it measures is a person's ability to process new information by observing how they perform leather lacing stitches. We use it when we suspect cognitive impairments, maybe due to a brain injury, dementia, or a chronic mental illness, that affect the ability to live safely and independently. The assessment is very hands-on. A small piece of leather with pre-punched holes, a shoelace with a needle on each end. Therapist demonstrates the running stitch. Therapist demonstrates the whip stitch. Therapist demonstrates the single cordovan stitch. The client is asked to copy the stitch. The therapist carefully observes the approach. Do they understand verbal instructions? Do they notice mistakes? Can they correct errors? How much prompting do they need? It's not about perfect stitching, but about cognitive processes while trying. Performance is scored on the Allen Cognitive Scale. Level 1, profound impairment. Level 6, normal functioning. Level 3 example, completes running stitch only after demonstration, can do simple repetitive tasks with long-term training. Level 4 example, completes whip stitch and recognizes errors. Capable of goal-directed activities, simple tasks independently. Level 5 example, solves problems, completes cordovan with trial and error, can learn new skills, greater independence. This objective information is invaluable for a safe, supportive discharge plan. The Occupational Circumstances Assessment Interview and Rating Scale, OCAIRS, is a powerful tool for getting a complete story of a person's life. It's actually based on the model of human occupation, MOHO. Think of the OCAIRS as a semi-structured interview. It doesn't just focus on one problem, it explores values, goals, interests, roles, habits, skills, plus how the environment supports or hinders participation. What it measures is the extent and nature of a person's occupational participation. We use it to get a broad, holistic baseline of functioning and to spot strengths and weaknesses. The assessment is a guided conversation, guided by a specific set of questions covering 12 key areas. These areas include roles, for example, parent, student, employee, habits, what does your daily routine look like? Personal causation, how effective do you feel in your life? Values, what is most important to you? Environment, how does your home and community affect what you do? The therapist asks open-ended questions and listens carefully, taking notes on the client's narrative. The goal is to encourage the client to tell their story in their own words. After the interview, the therapist uses a 4-point rating scale to score responses for each area. The scale looks at whether participation is supporting them, allowing them, inhibiting them, or restricting them. Imagine a young woman, Maria, who has stopped attending university because of depression. An OT might use the OCAIRS to really understand her situation. Maria reveals she highly values her role as a student. That's values. But she feels completely incapable of succeeding. Personal causation. She's lost her daily routine of studying and attending classes. Habits. And now spends most of her day isolated in her room. Environment. Habits. And now spends most of her day isolated in her room. Environment. The model of human occupation, or MOHO, is more than just a single assessment. It's a comprehensive theory that explains how and why we engage in occupations. It gives us a framework for understanding the dynamic nature of being human. At its core, MOHO proposes our engagement is driven by 3 interconnected components: volition, our motivation for occupation; habituation, our patterns and routines; performance capacity, our mental and physical abilities. Assessment tools based on MOHO explore these components. They help explain why someone might struggle to participate in life. Key MOHO assessments include Volitional Questionnaire, or VQ, Role Checklist, Occupational Self-Assessment, or OSA. MOHO isn't a single tool. It's a model with many assessments to understand inner drive and patterns of living. As a student, it is easy to see these tools as interchangeable, but a skilled therapist knows that choosing the right assessment is a critical clinical decision. The choice depends on the question you are trying to answer. The COPM is a top-down assessment. It starts with the client's big picture goals and life roles. The ACLS is a bottom-up assessment. It starts with cognition to understand how cognition might affect bigger tasks. OCAIRS and other MOHO tools provide a broad, holistic view, bridging top-down and bottom-up. Choose the COPM when your goal is client-centered goals and measuring progress from the client's perspective. Perfect for clients who can articulate feelings and goals but need help prioritizing. Less useful for clients with severe cognitive impairment or lack of insight. In that case, turn to the ACLS. Use ACLS when safety is a primary concern. ACLS gives an objective measure of learning and problem solving. Use results to make living situation recommendations. OCAIRS is ideal for a first meeting to understand a client's occupational life. Great starting point for complex cases where problems aren't clear. OCAIRS provides a rich narrative and structured summary of strengths and weaknesses. Meet Alex, a 45-year-old who has been off work for 6 months due to burnout and depression. He feels lost and has no energy for anything. An occupational therapist, Priya, is assigned to his case. Priya's first goal is to understand Alex's world. She decides to start with the OCAIRS to get a broad, holistic overview. During the interview, Alex talks about his identity being tied to his job as a project manager. So, roles. He reveals that he used to have a very structured routine, but now his days are empty, which is all about habits. He expresses feeling like a failure, that's personal causation, and that nothing seems important anymore, which touches on values. To dig deeper into his goals, Priya introduces the COPM. At first, Alex struggles to name any goals, but with gentle prompting, he identifies 3 things: being able to get out of bed before 10 a.m., cooking 1 healthy meal a day, replying to emails from friends. As they begin working on the goal of cooking a meal, Priya notices that Alex struggles to follow a recipe with more than 3 steps. He gets easily flustered and gives up. This observation raises a red flag for Priya about his cognitive functioning under stress. To investigate this, she decides to use the Allen Cognitive Level Screen, or ACLS. Alex is able to complete the running stitch and the whip stitch, but he needs several attempts and verbal cues to figure out the cordovan stitch, scoring him at a level 5.0. Armed with this complete picture, Priya can create a truly holistic plan. The OCAIRS told her the why, his loss of roles and routines. The COPM told her the what, the specific goals that matter to Alex. And the ACLS told her the how, that he needs tasks broken down into simple steps to manage his cognitive overload. Therapy now includes re-establishing a simple morning routine, which addresses habituation, exploring volunteer work to rebuild his sense of purpose, which addresses volition and roles, and using simplified recipes and checklists for cooking, which addresses performance capacity. This multifaceted approach, guided by multiple assessments, gives Alex the best possible chance of recovery. Skillful weaving of assessments creates a comprehensive, responsive, effective plan. These tools are often used in combination. Start with OCAIRS to get the big picture. If the client wants to return to work, use COPM to define work-related goals. If the client struggles with multi-step tasks, administer ACLS to check cognition. As we have seen, these assessment tools are far more than just paperwork. They are the heart of thoughtful and effective occupational therapy practice. Mastering the COPM, ACLS, OCAIRS, MOHO toolkit is not about memorizing steps or scores. It's really about learning the art of deep listening and structured observation. It's about learning to ask the right questions to unlock a person's story. For you, as a student, understanding these tools is the first step toward becoming a competent and compassionate therapist who can do more than just offer vague encouragement. You will be able to offer targeted, evidence-based, and truly personalized care. Each tool gives you a different lens through which to view your client. The COPM teaches you the profound importance of respecting the client's own voice and priorities. The ACLS provides an objective measure of cognitive function that is crucial for ensuring safety and providing the just right challenge. The OCAIRS and other MOHO tools give you a framework for understanding the complex interplay between a person's inner drive, their daily habits, and the world they live in. Together, they allow you to see the whole person, not just their diagnosis or their problems. They illuminate a person's strengths just as much as their challenges. Remember that assessment is not a one-time event. It is a dynamic and ongoing process. People change, and our therapy must change with them. Re-administering a tool like the COPM allows you to celebrate progress with your client and recalibrate goals as they move forward on their journey. This continuous cycle of listening, planning, doing, and reviewing is what makes occupational therapy such a powerful agent of change. It ensures that we are always walking alongside our clients, guided by their needs and aspirations, rather than walking ahead of them with our own assumptions. So as you step into your placements and begin your careers, embrace these tools. Practice them. Get comfortable with the conversations they spark. See them not as a chore, but as your most valuable resource for building rapport, understanding complexity, and making a genuine difference in people's lives. They are your compass, your map, and your magnifying glass. By learning to use them skillfully, you are not just becoming a better technician. You are becoming a better listener, a better partner, and a true artist in the science of occupation. And that is the foundation of a truly meaningful career.